This segment is sponsored by Mercy Health. Hopefully, you're keeping up with your regular healthcare visits despite the pandemic. It is both safe and smart to stay on top of these things, and that includes getting your mammogram. Dr. Courtney Garlick is the medical director of the Mercy Health Comprehensive Breast Center in Muskegon, and she joins us now. Hi, Dr. Garlick.
Hi, good morning. Thanks for having me.
Oh, glad to. Tell us, what are the current guidelines on mammograms? Who should be having them and when?
Yeah, there's a lot of confusion regarding mammograms these days. And, we still are very firm in our recommendation here at the Breast Center that, average risk women starting at age 40 and getting them yearly.
Average risk women, those who know they're in a different category, they work with their physician to figure out how often and when they should be doing it, right?
Correct. Yep, that conversation can be had with their primary care physician. And as well as we actually have a high risk program out here at the Breast Center.
Oh, very nice. Well, speaking of risk, a lot of people are scared right now to go to their doctor's office. But you are here to say it is safe and it is something that we should be doing.
Yeah, I wouldn't postpone screening mammograms at this point. Initially when COVID first hit last year, about a year ago, we did kind of halt them for just a brief period of time. But ever since then, we've been performing safe and efficient, mammograms ever since. So, I don't want people to postpone it just because of the fear of COVID. We've, put a lot of protocols and precautions into place.
All right, to keep folks safe. Apparently, there is a concern that side effects from the COVID vaccine could be mistaken for breast cancer on a mammogram. Can you explain that to me?
Yeah, so I communicate with a lot of breast imagers around the country, and we, pretty quick after the vaccine started to get distributed, we started to notice that we were seeing a little bit more of enlarged lymph nodes up in the armpit areas of women, and we can see that area just a little bit on mammograms, and so we just we want to prevent women getting called back too frequently for that, because basically that's a normal immune response to getting the vaccine in one of your arms, is for those lymph nodes to kind of plump up. Now, not everyone who gets it, but if it does, it's just, like I said, a normal immune response. But, enlarged lymph nodes in the armpit area can also be a sign of breast cancer that has spread to the armpit. So, we don't want, again, to have people getting called back too much for that. So just to be aware of that.
Good, important. Now, the Comprehensive Breast Center in Muskegon has received a pretty important accreditation. Tell me about what you received.
Yeah, so we just had our third accreditation now for our third cycle for NAPBC accreditation. And what that is, it's the National Accreditation Program for Breast Centers, and it's the hallmark nationwide for breast centers that are really dedicated to following national standards and guidelines for, the treatment of both benign and malignant breast disease. So we're really proud of our team here, and we really take a very multidisciplinary and dedicated approach to breast disease.
Yeah, because you really do look at the whole of health, right, when it comes to breast health.
Yeah, we do. And we all work together very closely. It's not just a very segregated, radiology and oncology and surgery. We all work together very closely on the breast care team, which really shows in getting this accreditation.
All right. Well, congratulations for that. I know it's important and quite a big deal. And we want to let folks know there are comprehensive breast centers located in Muskegon and Grand Rapids, and you can schedule your mammogram at either one. We have put all the contact information on our website at 13onyourside.com. Dr. Garlick, thank you so much.
Thank you for having me.